So Tommy was born with a cleft palate and a syndrome they call Pierrot band sequence, which just meant his jaw was really small. He had a big tongue and he had the cleft palate. So he had a really hard time breathing. So he was on CPAP and oxygen. And then by the time Dr. Morales and a craniofacial team got down here, they were pretty concerned and they wanted him transferred to primary children's.
TeleHealth was presented to us as an opportunity by the administration, and it was something that we felt was very fortuitous.
The telehealth, I would choose every time over the clinic experience. I was not looking forward to another clinic experience. There was a lot of going to see one doctor, go back to the waiting room, go in to see another doctor, go back to the waiting room.
TeleHealth is using modern technology to have doctor's appointments at different locations so that patients can stay where they are or stay closer to where they're from and get their needs met.
So the telehealth experience was a lot better. We showed up, he played on the iPad for a few minutes, we got called back, we talked to all the doctors sitting in one place. They were able to ask me questions, ask him questions, they got him talking. I mean, everything was just concise. We were in and out in maybe 20 minutes, and they got all their questions answered, and I got all my questions answered, and everyone was better off.
There's a real barrier, and I think this is true for all pediatric subspecialties. We find that many times the barriers are financial, many times it's travel, many times it is just lack of just not having the specialties. So it's not like it is here in the Wasatch.
The patients can receive so much better care doing it this way through telehealth because they are not having to travel. And this is really bringing best services and best care here to a smaller community, and they're able to be in a place where they want to be.
Having a team that really knew Tommy and everything about him, not just one guy that's working on a cleft and one nurse that's working on his G2. I mean, the whole thing, just working together. I would have not expected that type of personal care for him.
This approach with the telehealth clinic is so integrated, and it's a multidisciplinary team. We all see what each other is doing, and we all know the questions that are being asked from the providers as well as from the parents.
Everybody can really be on the same page, which makes it so much better for the patient. They can have a much better experience and feel like this is a cohesive team, and it works really well.